So today's video is going to be all about emotional intelligence, why it's important, and how you can use it to help you succeed in 2025. All right, I need y'all to picture this. You're at the bedside and you have this patient that is agitated and wants to hurt your soul to get what they want. They're super sick, but not only are they sick, they're being super mean and manipulative. They're yelling at everyone. On the back of your mind, you are asking, why do they even come if they are not going to comply and work with us? Where is the AMA form? I totally hear you. They were saying really hurtful things and you're redoing your best to try to help them, but they just continue to be mean. Maybe they're overdosing, maybe they're having a mental health crisis, maybe they're just in severe pain. Whatever it is, they're taking it out on you and your nursing staff and your medical team. So what do? How do you handle that situation? Well, first off, I'm going to tell you how to handle that situation from an emotional intelligence standpoint. I want you to remember that it's okay if you feel hurt by what they're saying. It's totally normal. You're a human being. Next, I want you to pause and take a breath before responding. And third, I want you to respond in a way that shows them respect, even though they may not deserve it. If you can do those three things, you will be able to handle any difficult patient situation with grace and professionalism. For that patient, they may not be able to tell you what's going on. They may not even know how to tell you what's going on. So you have to figure out what's going on with them. Are they in pain? Do they need something? Do they just need someone to listen to them? Once you figure that out, you can address those needs, and then they'll probably be a little bit nicer to you. I always remind myself that every minute that passes by, I am getting close to going home. But this mean patient is still stuck in misery. This thinking makes me more understanding in the face of hurtful words. I think that emotional intelligence is such an important skill for nurses because it allows us to do so many different things. It allows us to be better communicators, which is essential for nurses. It allows us to have better patient outcomes. And when we have better patient outcomes, we have happier patients and we have less lawsuits. It also helps us to work better with other members of the healthcare team. When we can understand our own emotions and control our own emotions, we're able to work better with doctors, with techs, with anyone else who's on the patient's care team. Emotional intelligence is simply put, the ability to understand your emotions and the emotions of others and use that to make better decisions. And I think that's such an important skill for not only nurses, but for everyone. Know your emotional triggers so you can control and manage them when you are faced with ungrateful and negative patient. Thank you guys so much for watching. Hope that you have a wonderful day. I hope that you find lots of joy in your nursing career. And I hope that you subscribe to my channel. Take care.